BusyBox's expert information on fractional skin resurfacing. What is fractional skin resurfacing?
Fractional skin resurfacing is the use of a laser, that is a new technology called fractional lasers. A fractional laser is simply, a normal dermatology laser that you would use for resurfacing. That can be CO2, that can be erbium, those are the most common ones. But the difference is on the delivery of the energy. Instead of, let's say, if you take a surface that you're going to treat, instead of treating the whole surface in an ablative way, which means that you actually create destruction or damage in the top part of the skin, what you're doing is you're making like little treatment zones that they are called micro treatment zones. That makes that instead of treating the whole area, what you're treating is about 20% of the area.
How do ablative and non-ablative lasers differ?
An ablative laser is a laser that creates a certain damage, especially on the top part of the skin. Usually that's what you see. So the consequence obviously is going to be, a kind of, it looks a little bit like a controlled burn. That's what an ablative laser does. This kind of laser usually tends to be more aggressive than a non-ablative. And because of that, usually the results, they tend to be better. Okay? However, sometimes as well, you can see that the risks are higher as well. The non-ablative is a laser that usually, or it could be an IPL, is a technology that what does is it has an effect deeper in the dermis, and it doesn't create any kind of sort of, you can call burn or destruction. It only creates thermal changes, heat, okay, which stimulates certain, things like the collagen stimulation and so on.
What does fractional skin resurfacing treat?
The ideal things are conditions where that they cannot be treated otherwise, like for example, acne scarring, any kind of scarring in the face or in the body, it doesn't matter. There is, FDA applications that they have been approved for things like, for example, pigmented lesions, dyschromias, melasma. Is for rejuvenation as well, general rejuvenation of the skin. And now as well, there is the latest application is for stretch marks, which is something very, very promising, because the stretch marks, obviously there is absolutely nothing you can do that really works. I've seen very, very good results for stretch marks.
Does it matter what color my skin is?
The good thing about the fractional laser, again, is that it doesn't make any distinct, it doesn't matter which is the color of the skin. That's another big, another big advance on it. Because the target of the laser energy is actually not the pigment, but is actually the water in the tissue. So it doesn't matter which color of the skin is.
Who should avoid fractional skin resurfacing?
The people that shouldn't obviously have the treatment is people that usually they have bad reactions with the treatments of laser, and people that take certain medications, certain antibiotics, certainly people that is pregnant or breastfeeding.
Do I need to see my GP first?
It is always a good thing if you want to ask, the opinion of your GP, because that will be the person that knows your medical history better than anybody. However, when you're having a treatment by a physician, the physician will actually do your relevant medical history, and he will be able to pick up whether you would be a good candidate or not. So you don't need to ask him.
Do I need to prepare for fractional skin resurfacing?
The usual thing is that if you're going to have laser treatment of any kind, is that you haven't been under the sun at least for 3 weeks or a month. That's the ideal.
What happens during fractional laser treatment?
Fractional laser treatment is not a painless treatment. So what we need to do is we need to apply a certain degree of anesthesia. Usually is a cream that you apply for about an hour before the treatment. Then you go into, in our case, the theater. You're lying down, you're still awake, but you're not going to feel that much pain. It's a little bit uncomfortable. And then, the doctor will just simply make passes with the handpiece, and obviously will ask you how you're feeling. Is it more painful? Do you want me to take a break? Whatever. It's a treatment that is not, as I said, is not painless. It's a little uncomfortable, but that is how it works.
What happens after the treatment?
After the treatment, you might have swelling, you might have redness. Sometimes you might have bleeding, depending on whether it's a CO2 or it's not. But the usual is that it's not like it used to be, in the past, that the resurfacing with the laser was, leaving you with a really not very nice appearance.
Is fractional skin resurfacing painful?
It is a treatment that you require anesthesia for. So once the anesthesia is achieved well, most patients tolerate it very well.
How does my skin look after fractional skin resurfacing?
You expect to see redness, you expect to see swelling, you expect to feel a little bit tight, of course, in the area that has been treated. Sometimes a little bit of bruising, but it's very unlikely. I mean, that is the usual thing.
How long will I take to recover from fractional skin resurfacing?
I'd say that usually, I mean, most of my patients after the treatment, after a couple of days or 3 days, they can resume activities.
What results can I expect?
The results are usually very good because, as I said, it's like you're doing resurfacing without having to create a lot of damage on the skin, not visible damage. You usually need a course of about 4 treatments. For the reason I mentioned, because you're treating about 20% of the skin, so obviously it's like you're having the treatment on installments, if you want to call it.
How long should I leave between treatments?
Usually is that you allow the skin to recover, and that's say 3 weeks to 4 weeks between treatments.
Does the patient have any post-treatment procedures to follow?
Yes, of course. We actually give them, a post-treatment care instructions. We give them as well, a set of products that they have to use to help, on the healing of the skin. And well, the most important is to stay away from the sun.
Are the results permanent?
The results that you can achieve with a fractional laser, usually they tend to last for years because you have been sort of provoking a remodeling of the tissue. That usually tends to last a long time. However, any kind of remodeling, which is the stimulation of new collagen from the own patient, it's something that doesn't happen overnight. New collagenesis happens over the space of 3 to 6 months following the treatment. So it is not a treatment like dermal fillers or Botox that you see almost immediate results. It's a treatment that you have to have a little bit more of patience, but the results can be very good.
When can I expect to see the results?
Partial results might appear after a week or 2, but the real results that you want to see, usually they tend to take about 3 to 6 months.
Who can perform fractional skin resurfacing?
As far as I know, only physicians that are specialized in aesthetic medicine.
How much does fractional skin resurfacing usually cost?
It depends on the area that you're going to treat. It depends on the surface. If you're treating, let's say, for example, only the cheeks, there's many people that they have acne scarring. The cheeks will cost you, a course of 4 treatments might cost you about £2,000 in total. If you're treating, for example, the full face, neck, décolleté, if you treat the full face, it might cost you about £800 per treatment, but that is obviously because it's a long treatment, requires quite a lot of time. So it really depends on how big is the area you're treating.
www.busybox.com